So let's look at some of the healthcare guidelines from late adolescence through menopause. Now recall, most of the exams are provided by an OBGYN physician or nurse practitioner. We're going to start with menarche. Once again, what is it? Well, it's actually sort of a rite of passage. If you Google menarche under Google Images, you'll be shocked at what you find. There are people who actually have menarche parties, and you can buy all types of t-shirts and party favors that celebrate this girl's passage from being a girl to a woman. Now keep this in mind of psychologically, what does it mean when a woman goes through menopause? Because now the period is gone. So menarche is the onset of the first menstrual period, and what it indicates is maturation of the sexual organs and the eventual ability to conceive. Now keep in mind, just because a woman has normal menstrual periods does not always mean that she will be able to conceive when it is desired. So what is normal? Well, a normal menstrual period is regular and it occurs monthly. It should occur within every 21 to 42 days to be considered normal. The flow usually lasts between 2 and 7 days, and sort of the outlier in how long you flow would be 10 days, and then it would be considered excessive. It is ideal to have a 28-day menstrual cycle. It eases conception because the timing of ovulation is so consistent, and it also is very helpful in improving success rates for those who are using natural family planning as their method of contraception. So we do a lot of routine screening exams at the Well Woman exam. At these exams, we perform pap smears, STD screening, we make recommendations for mammograms, and a pelvic and breast exam are performed. So when you look at the picture on the right, you can see where the end of the cervix is. On the left-hand side, where the arrow is, that is the end of the cervix. And what we do is we scrape tissue either with a brush or a stick to obtain cells. We place these on a slide and then use a fixative, or we can place it in a small plastic container that also has a fixative. And these are various means of obtaining pap smear samples of tissue. And what we're looking for on the pap smear is moderate to severe dysplasia that can eventually turn into cancer. Once again, we're going to go back to the Healthy People 2020 goals. So our goal related to pap smears is to increase the proportion of women who are counseled about getting pap smears. Currently, we're at a rate of 60%, but we want to increase that by 10% up to 66%. So many women know that they need to have the pap smear, but the thought of going in and having a pelvic exam scares them, or they don't have money or whatever, and they don't go in and have them done. The pap smear guidelines have changed recently. The American College of OBGYN, abbreviated ACOG, developed new guidelines based on the evidence of and incidence of cervical cancer. This was done in 2012. The guidelines have been tweaked since then, but they really are a dramatic change from what many of you are used to. So now pap smears need to begin at the age of 21. Gone are the days that the pap smear needs to be done within the year of first intercourse or within a couple of years of menarche. Another big change is women between the ages of 21 to 29 need a pap smear only every 3 years. The rationale behind this change is that when we see changes in a young woman, we know that they have healthy immune systems. Oftentimes, they are able to clear up these minor changes in the cervix on their own without any interventions by the OBGYN or nurse practitioner. We used to burn the cervix, freeze the cervix, laser the cervix, for like type 2 type changes in the pap smear. All of these procedures cause scarring of the cervical opening. Then when a woman is pregnant and goes in to have delivery, it's difficult for that cervix to dilate to deliver a baby. So what does that mean? Higher incidence of cesarean sections. So now the guidelines are telling us to follow the hands-off approach. Let the human body repair itself. Now note, women who are HIV positive do not follow these guidelines. Why? Because they're immunosuppressed. In addition, women who've been exposed to DES, diethylstilbestrol, they do not follow the guidelines. These women are currently in their 60s and 70s, so we're not going to see too many DES exposed women. The problem with DES is that there was a very high rate of genital cancer, cervix, vaginal, vulvar, and then in men we see penile cancer from the offspring exposed to DES. So additional changes, women between the ages of 30 to 65 have two options. They can obtain a pap smear and an HPV, human papillomavirus, or the wart virus, test every 5 years. If they elect not to have the HPV test, they need to have a pap smear alone every 3 years. So as a woman ages, if pap smears have been normal, after age 65, a pap smear is no longer needed. But the qualifications for this is they have to have had no previous history of having moderate or severe dysplasia, and the last 3 pap smears have to have been negative, and the most recent of these would be within the past 5 years. If there's any abnormalities within the past 5 years, or this woman has had a past history of moderate to severe dysplasia, this woman would continue to have pap smears every 3 years. So ladies, you have something to look forward to.